Hello, Mama, and welcome back. If you've ever settled into bed after a long day, finally found a comfortable position, and then suddenly felt an overwhelming urge to move your legs, you're definitely not alone. Maybe your legs feel tingly, restless, itchy deep inside the muscles, or almost impossible to keep still. Every time you stop moving, those strange sensations seem to come right back. Instead of falling asleep peacefully, you're stretching your legs, changing positions, or even getting out of bed to walk around. If this sounds familiar, today's video is just for you. Restless Legs Syndrome, often called RLS, is one of the most common sleep-related concerns during pregnancy, especially in the second and third trimesters. Although many women experience it, that doesn't mean you simply have to accept it as part of pregnancy. In many cases, understanding what may be contributing to your symptoms can help you find ways to feel more comfortable and sleep better. So, what exactly is restless leg syndrome? It's a condition that causes an irresistible urge to move your legs, usually when you're sitting still or lying down. Many women describe the feeling differently. Some say it feels like tiny insects crawling under the skin, while others describe tingling, buzzing, pulling, aching, burning, or a deep itch that scratching simply doesn't relieve. These sensations usually become stronger during the evening or at bedtime, exactly when you're hoping to relax and get some much-needed rest. As soon as you move your legs, stretch, or take a short walk, the discomfort often improves, but unfortunately, it usually returns once you become still again. This repeating cycle can make it incredibly difficult to fall asleep and may even wake you up several times during the night, leaving you feeling exhausted the next day. The good news is that you're far from alone. Studies suggest that many pregnant women experience restless legs at some point during pregnancy, particularly during the third trimester, when the body is working harder than ever to support a growing baby. For many mothers, the symptoms gradually improve after delivery, but that doesn't mean you should simply suffer through months of sleepless nights. Pregnancy brings incredible changes to your body, and understanding those changes can help explain why restless legs happen in the first place. During pregnancy, hormone levels such as estrogen and progesterone rise significantly. These hormones are essential for maintaining a healthy pregnancy, but they also influence your nervous system, muscles, and circulation. Researchers believe these hormonal shifts may make some women more likely to develop restless legs, although hormones are only one part of the picture. Another major factor is the tremendous increase in blood volume that happens during pregnancy. Your body produces nearly 40 to 50% more blood to supply oxygen and nutrients to your growing baby while preparing for childbirth. This amazing adaptation also changes the way blood circulates through your body. Some women notice heavier legs, swelling, or a feeling of discomfort, particularly after standing or sitting for long periods. As your uterus continues to grow, it may also place pressure on nearby nerves and blood vessels in your pelvis and lower back. This pressure can contribute to tingling, numbness, heaviness, or unusual sensations in the legs, making the urge to move even stronger, especially during the evening when you've been active throughout the day. Sleep itself also plays an important role. Pregnancy can make sleeping difficult for many different reasons. You may be waking up several times during the night to use the bathroom, struggling with heartburn, dealing with back pain, or trying to find a comfortable sleeping position as your belly grows larger. Because your sleep becomes lighter and more interrupted, you're often much more aware of uncomfortable sensations in your legs. This creates a frustrating cycle. Poor sleep makes restless legs feel worse, and restless legs make it even harder to get quality sleep. Breaking this cycle is one of the most important goals when managing these symptoms. Another important piece of the puzzle is nutrition. During pregnancy, your body requires significantly more vitamins and minerals than usual because your growing baby depends on you for everything needed to build healthy bones, muscles, nerves, organs, and blood cells. If your body isn't getting enough of certain nutrients, it may contribute to restless leg symptoms. Researchers have found that nutrients such as iron, magnesium, folate, and vitamin D may all play important roles. Iron is especially important because your body needs it to make hemoglobin, the protein inside red blood cells that carries oxygen throughout your body. Since your blood volume increases so much during pregnancy, your iron needs also increase. If iron stores become too low, some women develop symptoms like fatigue, weakness, shortness of breath, and in some cases, restless legs. Your healthcare provider may recommend checking your iron levels if they suspect this could be contributing to your symptoms. As we continue through this video, we'll explore other possible causes of restless legs during pregnancy, discuss nutrients like magnesium in more detail, and most importantly, share practical, pregnancy-safe strategies that may help you feel more comfortable and finally get the restful sleep your body needs. In Part 2, we'll cover magnesium, iron deficiency, safe home remedies, stretching, hydration, massage, and sleep tips in detail. Now let's take a closer look at one of the biggest questions many expecting moms ask. What can I actually do to make restless legs feel better? The answer is that there usually isn't one single solution. Instead, it's often a combination of healthy habits, good nutrition, and addressing any underlying deficiencies that can make a real difference. One nutrient that receives a lot of attention is magnesium. Magnesium is an essential mineral involved in hundreds of processes throughout the body. It helps muscles relax after they contract, supports healthy nerve function, contributes to normal sleep, and plays an important role in overall muscle comfort. During pregnancy, your body's need for magnesium increases because it supports both your health and your baby's development. While some women find that increasing magnesium through magnesium-rich foods or supplements recommended by their healthcare provider helps improve muscle cramps or overall comfort, research specifically on magnesium for restless legs syndrome in pregnancy is still limited. That's why it's always important to speak with your doctor or midwife before starting any new supplement. Iron is another nutrient that deserves special attention. Even if your routine blood test shows that your hemoglobin level is normal, your iron stores, measured by a blood test called ferritin, may still be lower than ideal. Low iron stores have been linked to restless legs syndrome in many people. Because of this, your healthcare provider may decide to check your iron levels if your symptoms are frequent or severe. If an iron deficiency is found, treating it under medical supervision may help reduce symptoms over time. It's important not to start iron supplements on your own, though, because taking too much iron can also cause problems. Your healthcare provider can recommend the right dose if supplementation is necessary. Your daily diet also plays an important role in supporting healthy muscles and nerves. Try to include foods rich in iron, such as lean meats, poultry, beans, lentils, spinach, and fortified cereals. Foods that contain magnesium include almonds, pumpkin seeds, peanuts, black beans, whole grains, avocados, and leafy green vegetables. Vitamin C-rich foods like oranges, strawberries, kiwi, tomatoes, and bell peppers can also help your body absorb iron more effectively when eaten with iron-rich meals. Staying well hydrated throughout the day is equally important because dehydration may contribute to muscle discomfort and nighttime cramps. Aim to drink enough water consistently, but you may find it helpful to reduce large amounts of fluids close to bedtime if frequent nighttime bathroom trips are disturbing your sleep. Gentle movement during the day can also make a noticeable difference. Pregnancy-safe exercises such as walking, prenatal yoga, swimming, or simple stretching improve circulation and may reduce stiffness in the legs. You don't need an intense workout. Even a 20 to 30-minute walk, if approved by your healthcare provider, can help many women feel more comfortable by bedtime. Before going to sleep, try slowly stretching your calf muscles, hamstrings, and thighs. Hold each stretch gently without bouncing, and never stretch to the point of pain. Some women also find relief by rotating their ankles, flexing and pointing their toes, or performing a few gentle leg movements while sitting on the edge of the bed. Massage is another simple strategy worth trying. A gentle massage of the calves and thighs may help relax tight muscles and improve circulation. If you have a partner, they may be able to help with a light massage before bedtime. Some women also enjoy using a foam roller or a handheld massage device designed for gentle muscle relaxation. Warm baths before bed can be soothing as well. The warmth helps many muscles relax and creates a calming bedtime routine that signals to your body it's time to sleep. Be sure the water is warm rather than hot, as very hot baths are generally not recommended during pregnancy. Some women prefer applying a warm compress to their legs, while others find that a cool compress provides better relief. Because everyone's body responds differently, you can safely experiment to see which feels more comfortable. Creating healthy sleep habits can also reduce the impact of restless legs. Try to go to bed and wake up at about the same time every day, even on weekends. Keep your bedroom cool, quiet, and dark, and avoid spending too much time looking at your phone or other bright screens just before bed. The blue light from electronic devices can interfere with your body's natural sleep hormone, making it even harder to fall asleep. Instead, consider reading a book, listening to calming music, practicing gentle breathing exercises, or enjoying a relaxing bedtime routine. Some women notice that caffeine, especially later in the day, seems to make restless legs worse. If you consume coffee, tea, chocolate, or caffeinated soft drinks, you may want to discuss with your healthcare provider whether reducing your caffeine intake could be helpful. Finally, remember that stress and anxiety can sometimes make symptoms feel more intense. Pregnancy naturally brings excitement, anticipation, and sometimes worry about labor, delivery, and becoming a parent. Taking a few minutes each day to practice relaxation techniques such as deep breathing, meditation, prenatal mindfulness, or gentle stretching may not completely eliminate restless legs, but they can help your body feel calmer and better prepared for restful sleep. In the next part of this video, we'll discuss when restless legs may require medical evaluation, warning signs you should never ignore, common myths, frequently asked questions, and the key takeaways every expecting mother should know. Thank you so much for spending your time with me today. I hope this video has helped you better understand why restless legs can happen during pregnancy and given you practical ideas that you can discuss with your healthcare provider. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and turn on the notification bell so you don't miss future videos about pregnancy, labor, childbirth, postpartum recovery, and newborn care. I'd also love to hear from you in the comments. Have you experienced restless legs during pregnancy, and what has helped you the most? Your experience could encourage another expecting mom who may be feeling the exact same way. Until next time, take good care of yourself, stay healthy, and remember, every step you take is bringing you closer to meeting your beautiful baby. See you in the next video.